Great. Well, thank you very much for having me. And yes, and I'm happy to come back. I'm happy to talk to folks, answer questions if they come up when they watch the video. I know it's a hard time. It's a busy time here. Trying to figure out what's the next right thing to do. So it is respiratory season. So we'll talk a little bit, and we can try to focus a little bit on respiratory season to the extent we can. And like I say, I'm happy to answer questions in the future or come back. But I'm going to talk in general about where we are with flu, COVID, and RSV primarily. Talk a little bit about a specific program that we're putting together focused on farm workers, some farm workers across the state. And then we, DHHS, did some new market research trying to understand kind of vaccine, people's intent around getting vaccine, concerns, questions. And I want to share a little bit of that data with you because I think there's probably some helpful pieces in there about how we engage communities and talk about vaccines. Um, so, oops, let me start here. So this graph, the takeaway, I'm going to show you some slides that maybe are a little not super, just kind of obnoxious, I guess. But I'll give you a takeaway for each one of them, I promise. But this is just to kind of give you a sense of emergency department visits, and these are COVID-like illnesses. So the red line in the middle is the line that is this year, and so you can kind of see very clearly here. We had a pretty high extended summer surge from COVID that might have caught us a little bit off guard, but we're at the place where we're starting to see that curve from the summer surge decline a little bit. So that's good news. We've seen a decrease in emergency room visits. This slide also take a look at the red line. This is flu, and we are in the place where we're starting to see flu kind of here. We've seen a decline from last week, but overall you can see the general trend is flu cases, flu-like illnesses starting to pick up across North Carolina. And then this is all kind of all respiratory kind of cases that we're seeing across a hospital network. And really the takeaway here is what I just said, kind of COVID is declining, coming off the summer surge, but we're starting to see pickup in flu and RSV cases across the state. Slide again, the takeaway from here is we're gonna talk, we have new and updated vaccines available for COVID this year. And this pink right here in the middle, if you can kind of see the two pink, I just really want to show you that the vaccines, in the spring, there was a recommendation for a vaccine and a vaccine recipe from CDC. COVID changes fast, right? It probably twice as fast as flu. So between the June recommendation and the release of the COVID vaccine in September, we actually went with a new recipe to try to be more closely aligned with the variant that we're seeing, which are these KP2 and KP2.3. They're Omicron subvariants, so they're related to each other, and the vaccine is focused on that family or that kind of grouping of variants. So we changed it to keep up with the vaccine, which I think is good news. Sorry, so for COVID vaccine, just again, there is a new vaccine out recommended for everyone 6 months and older. We have what we're familiar with, a Pfizer vaccine and a Moderna vaccine, which are both mRNA vaccines. And then we have Novavax, which is a different kind of vaccine for folks who don't want an mRNA or can't take an mRNA for some reason. So we have all three choices available again this year. Particularly important, same recommendation to get a vaccine. If you're 65 years or older, you have an underlying medical condition, folks who live in long-term care facilities or other institutions, and then people who are pregnant, breastfeeding, or planning to become or might become pregnant to protect yourself and also your baby. We also have an updated flu vaccine for this year. So it's focused on 3 different strains of the flu. And again, everyone 6 months and older recommended to get a flu vaccine this year. Then we have, it was new last year. We have much more supply of it this year, so you may be hearing more about it, an RSV vaccine. This vaccine is a little bit different because it's not an annual vaccine, so you just get it once at this time. But we have a couple of different, and it's focused on just certain populations, so people who are 75 and older, and then babies, infants, young people, right? So we have a version that can be given to pregnant people, pregnant women, that will, at certain points in the pregnancy, that will help protect the baby. But we have a monoclonal antibody. You might be familiar with that phrase from COVID, but we have an immunization, we're calling it. It's not a vaccine, but an immunization that can be given to newborns. So I think this is an exciting vaccine. I think this is a really important kind of advancement in vaccine and immunization because of the impact that RSV can have on younger people and older people. So, this is just a summary slide I put in here to kind of be helpful to think about what vaccines and when. Flu and COVID vaccines can be given at the same time, so we don't have to go back and forth if folks have challenges getting back and forth to the doctor. Also, if you've had COVID, because our summer surge was so long, right, a little bit different than before, there's some confusion, right, about when do I get a vaccine if I've had COVID. Trying to time a surge is it's like trying to time, I don't know, we can't really do it well. So the recommendation is to go ahead and get a COVID vaccine. If you had COVID recently, you can probably wait up to about 30 days, 3 months before you get a vaccine, unless you're at high risk, unless you have some other kind of co-occurring condition. And then in that point, just go ahead and get your vaccine. We have a specific program this year. You may have heard that we have highly pathogenic avian flu, or H5 is what we call it. H5N1 bird flu is what it's also often called. We had a herd of cattle in North Carolina test positive for this in the spring. So we are part of a group of states that is participating in a program to try to protect farm workers who are working with farm animals. So this flu is this year has gone from being present in poultry flocks to now being present across 40 different kinds of mammals, which is a big change for this virus. So we want to be really thoughtful in terms of how we protect farm workers. So we are working, the immunization branch is working with 20 counties in North Carolina to get additional doses of flu vaccine available for no cost to farm workers that work with animals, live in congregate housing with other farm workers who work with animals. And one of the concerns is, I think we want to make sure that we take the vaccine as close as we can to the farms or to the people to make it as easy as possible. We did recently have a case of bird flu in Missouri, where there is no immediate known animal exposure, right? So this concerns us because it means there's likely some community spread already happening. This flu mostly looks like pink eye, right? It mostly looks like conjunctivitis, so we're probably missing some cases. It's been hard to detect. So we just want to be sure, again, that we're reaching as many people as we can, to get protected. Is there a question? Sorry. These are the counties that we are working with right now to move these additional doses of flu vaccine to protect farm workers. We're also trying to work with the FQHCs to figure out where they might be differently positioned or better positioned to reach this population, and can either develop partnerships or work with the local health departments to administer vaccine. We're trying to move resources to be able to make them available to FQHCs. We're not able to announce that yet, but we're working on it to try to make sure that this effort is as robust as it can be across the state. I want to turn just quickly. Last thing I'll talk about is this new market research that we did, trying to make sure that as we think about communications, as we think about access strategies, that we're taking communities we're thinking about communities in ways that are more relevant to them. So when we talk about vaccine confidence, we talk about the fact that we want to try to help people believe that vaccines are a good solution and that they work, right? They have some trust in vaccines. But I know particularly with the Latino community, we talk a lot about vaccine confidence and we ignore vaccine access, right? And so I think some of this data really shows us that we need to work on both, specifically for Latinos, that there is a lot of intent to get vaccinations. We just sometimes make it really hard, or not easy. And part of the reason that this is important, this data is from, we pulled this from early in the pandemic, right? So this is 2021, 2022, but what we saw, not surprisingly, right, is this disproportionate impact of COVID on communities of color. And so you can see in this far right column for Hispanic or Latino persons that we have, when compared to non-Hispanic white people, one and a half times more likely to get the disease, right? And then to be hospitalized and to potentially die from it. So, these are older numbers, but we have reason to believe that they're similar, right, as we go forward. So we asked a lot of questions. We kind of went through the state and asked questions of different populations. And one of the things we learned is that Latinos in North Carolina believe at a higher rate that the vaccine is as dangerous as COVID, right? So this was something we were able to find out by talking to people. So it helps us understand what are the kinds of education or what are the kinds of conversations we need to have out in communities, and how does that differ depending on the population. For Latinos, distinguishing between sort of how dangerous the virus is, and then whether or not that the vaccine is not dangerous. Why there are some things to look out for in some populations, that it's safe and effective across the board. That message is an important one. Here, I know again this slide is kind of confusing, but if you look at this green column here, we have when we talk to people about what are the kinds of things they would need to hear to be able to have more confidence in the vaccine. For Latinos, we see specifically sort of reassurance that it's effective and that it works and that it will protect you. Information about the likelihood and the severity of side effects was something people wanted to know about. And then people in the Latino community really wanted to know more about research, testing, like what is the proof that the vaccine works? So I'll share these slides with you. And certainly, I think you can take a look at kind of these top answers for the communities that you work with, but specifically for Latinos, and that may help you design strategies to do outreach and to kind of bring education and information to the communities that you work with. This slide, again, I know these slides are terrible. We just got them back and I wanted to show them to you. I got excited to show them to you, so I didn't have time to clean them up. But what's important about this slide is the dark blue and the light blue above the line, right? And so those are the folks that said they will or definitely will get a vaccine. And so you can see in the sort of total column is everybody. Are Latinos, 55%, that's a good number, right? So this is what I was talking about when I was saying we want to be really thoughtful about what is actually getting in the way of people being vaccinated. Is it that they don't trust the vaccine or want to have a lot of questions about the vaccine? Is it access? Is it both? And we need to pay attention to both with the Latino community, I think. You can see that income, people who make less than $50,000 are less likely, have less intent to get. And then the level of education matters. as well. Uh, this column is, or this graph is about, we talk to parents about the intent to get children vaccinated, right? And so again, you can see generally the trend is the older your children get, the more likely we are to vaccinate our children get, the more likely we are to vaccinate them. But again, for Latinos, we see 52% for ages 5 to 11 and 65% for 12 to 15. So those are good numbers. So we need to make sure that we're continuing to talk to people. This is how we're reading these, right? We need to think about access, Latino communities very specifically.